I mean, what is it going to take for me to get you right? I brush my teeth before I go to bed. I floss before I go to bed. I take a shower before I go to bed. I do it exactly the same every single night. Why would we not do it exactly the same? The metrics are the same. Okay? When you guys start deviating, that makes me wonder what else are we deviating on, right? Because if we're deviating on the things that I can see, what are the things I don't see that we're deviating on, right? Like a face mask putting too much pressure on the face. The reason why we have great results is we do it the same way every single time. AP. All right. Without further ado, welcome to Deuk Spine Institute's live stream. It is now August 3rd, 2023. Perfect. Our lady here who's having surgery has 3 discs in her back that are severely damaged and causing her horrific pain in her back that goes into her right hip. You can see the first here. We're almost at the disc, and it's a huge herniation. I can actually feel the herniation right now with the tip of my needle. Okay? Shot. Can we not have these little things bothering me? All right, so I'm hitting something bony. She okay?
She's resting.
All right. Shot. Shot. Good. So we're almost into our first disc. She shot. Let's see here. Shot. So I'm trying to crawl along and just finish getting this into position. It's not really happening. Literally bumping up against just a tiny little piece of bone right there. I'm going to go back and redirect. Shot. AP. Looks good. All right, let's make our incision. I think we can get that in later when she's more relaxed. We'll try again. I'm going to make our incision at 7 millimeters. This is endoscopic spine surgery. It doesn't require big incisions like open surgery does. Shot. What we need to do here is get into the disc spaces that are causing pain and basically repair those discs. I'm not happy right now with that. I am happier with that. I feel the facet, and I'm going to sneak into the foramen and get into the disc. Let's go to the next one. Is that my hand right there, Jordan? Huh? It was? All right. Can you at least not radiate my hands unnecessarily? What is it? People went into the twilight zone today? I guess they think that's too easy for me to do these surgeries. They want to make it more challenging. Shot? 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 It's the transverse process I'm bumping up against. I'm not going to be able to do it through the same incision. I'm going to have to make a separate incision. Num num? Go ahead. Shot? Yeah. The problem is the scoliosis oftentimes will, or the patient's anatomy will force you to make a second incision. All right, feels good. You're pulsing, Jordan? Shot? Just want to make sure. Shot? Shot? All right, need to be a little bit higher. Shot? Shot? There we go. All right, let's try to get 5-1 one more time. Shot. Let's get that disc lined up. Henry, let's show our video on why do disc herniations and degenerative discs, why do they cause so much pain to begin with?
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
Okay, now you understand why herniated and bulging discs cause so much pain. It's due to inflammation in the back of the disc. That's what we're going to fix today for this young lady. Shot? Well, I'm struggling to get into 5-1 because of the angle. Shot? I'm just bumping up against the top of that end plate, and I have no way to get past that. So I'm going to go ahead and just means we won't be able to test 5-1. Let me try one more time with the stylet. Shot. It's literally just bumping up against the bone. Almost got it. Shot? It's like right there. You know, it's starting to slide right along the end plate. She's got good hard bone. That's a nice thing, huh? The dilator? No. I mean, we're going to get it. I'm not worried about that. I just wanted to test it. And I'm not going to be able to test it. It's fine. Well, we can't do our discogram there because I'm not in the disc. I'm right just at the back end of it. And if I inject dye, it's going to push up against the end plate. So, how long has she had back pain for? So she's had, for the last 4 months, it's gotten worse. How long was it there before? How long she had originally had back pain?
She said it started in April when she was working in a greenhouse, and then it got worse after that.
So that's never the case? It's never 4 months, just so you know? These people have back pain for years. It gets worse or constant 4 months ago. I'm not interested in when it got worse. I'm interested in that, but I'm interested in how long they've had back pain. Right, but you have to ask the right way. You didn't ask the right way. Okay? So, how do you ask the right way? 4 months. My answer to you is 4 months.
We asked her about car accidents, she said no to us. We asked her about any falls or any issues that she played any sports, she said no.
Again, fail, fail, fail. You guys failed.
She said she's had neck pain. She had a bunch of sort of that, but not mentioned any other back pain.
So this is unfortunately my life. It's like God is punishing me with people who don't do their job properly. Great. Here's how. When was the first time you ever had back pain in your life? See how easy it is?
What was your answer?
How long have you had back pain? Every one of these patients, they start their back pain, it goes away, it comes back, it goes away, it comes back, it goes away, it comes back, goes away. Okay? If you knew about these patients, you'd know that. Then they get to a place where it's constant. And then they come running to the doctor, save me, I'm in pain all the time. Okay? So we're not interested in when it became constant. We want to know how long they've lived with back pain.
See, that's like, I don't think she must have
It's a simple question. And it's literally, when was the first time you ever had back pain? And what does she say now? 30?
Started at the age of 30.
How old is she now, roughly? So that doesn't sound like the same answer to me. Right, but nurses, you're missing the point. The information's there. You're not getting the right information. Right? Have you ever asked a patient, are you on pain meds? No. Well, why does it say Lortab here? Oh, well, yeah. That's a pain med. Are you an alcoholic? No. How much do you drink? I don't drink. You never have beer? Oh, I have beer. How much beer do you drink? I drink a 12-pack a day. But isn't that alcohol? No. What's alcohol? Vodka. Okay? You guys are healthcare professionals. It's not acceptable to get wrong answers from patients. You have to get the right answers. You have to learn how to ask the questions. Right? And what should you do when they do that? Redirect to the back pain. You have to document they have neck pain, sure. But you're after the back pain information. Don't let people take you off course. Okay? Point is, learn how to ask questions properly. You have any allergies to medications? Nope. Oh, okay. Have you ever gotten a rash from taking a medication? Oh, yeah, I do. Which one? Penicillin. Oh, well, that's an allergy. Okay? Don't lower yourself to the level of a layperson's understanding of healthcare. You guys went through school to learn to do better than that. Right? So expect more from yourselves. Don't just settle for one way to ask a question. Do you have allergies? No. You ever get a rash? Oh, yeah. Have you ever had an anaphylactic reaction? Yes, I did, as a matter of fact. I think it was to, I don't know, like shellfish? Oh, really? Iodine? Yeah, that's it. Okay? If you just ask them and rely on that one question to answer it for you without probing, you're going to get the wrong information 50% of the time. And guess who's going to suffer? Not you. You get to go home, watch movies, hang out tonight, go to dinner, party, but the patient is the one who dies. So your mistake cost somebody their life. That's why we're healthcare providers. We don't just do things half-assed, okay? Especially not here. I won't tolerate it. So learn how to ask questions properly. Hey, what's your pain level? 10. 10 out of 10? Yeah. Is that a 10 out of 10? No. They're sleeping. They're not moving. That's not a 10 out of 10. That's the wrong answer. And if you write down 10 out of 10, you don't deserve a license. Okay? And I certainly don't want you working here. So I'm seeing a lot of little mistakes. Jordan not putting the table down properly. These are things we do every single time. And you got to learn how to ask questions the right way every single time. Otherwise, the information's unreliable. We can't do surgery on unreliable information. Okay? Is she ready?
Yes.
Are you awake? All right. So we know you've had back pain for 18 years. And it's been real bad for the last 4 months. Okay. So are you comfortable right now? Any pain? Huh? Your right hip's bothering you? All right, I understand. That's probably from your disc problem. All right, so now we know that we have some bad discs. The only one I really can't test is L3-S1 because I can't get the needle fully into it. So we're going to get in later when she's asleep, but we'll take care of it. The only problem is I can't test it. Are you comfy? All right. Hear that? All right, how bad is that on a scale of 1 to 10? How high does it go?
7.
You must be giving her good pain meds. She almost came off the table for a 7. You sure it didn't go higher than that? All right. I couldn't hear.
7 is the highest?
What's the highest it went?
7.
Scale of 1 to 10, 10 being the worst pain of your life. That's what I thought. All right. Is that where you typically get your back pain? Wonderful. That's great news. That's going to be gone when you wake up. So that was a 10 out of 10 at L45, ladies. 10 out of 10, L45, concordant. All right. I'm sorry. We're almost done. We'll stop torturing you in just a moment. You're okay. All right. Is that better? Good. Just take a minute, take 3 deep breaths. You're doing great. The good news is that pain will be gone. Jordan, take a shot. Show us where the tear is. You guys see the tear on that thing? There's actually more than one tear. There's one that goes up and there's one that goes out. The one that goes out is so scarred up you can't even see the dye, but you can see a bleb of it right there. Yeah, thanks, Jordan. Good job. Okay, that's where her pain's coming from. Is that better? Yes. All right. So sorry. We're almost going to put you to sleep, okay? How bad is that? What's the highest it went? 8? And is that where you get pain normally? All right, 8 over 10. And it's concordant. Again, I cannot test the bottom one, but I guarantee you that thing is hurting. You get to go to sleep now. When you wake up, your pain will be gone for the rest of your life. Now, this young lady here and her husband, they own a farm. They work on the farm. And she hasn't been able to do anything to help her husband for years because her back's been bothering her. And what she does, though, is she kind of avoids doing things, right? That's what people do. That's why it's important to know when the pain started. Because when the pain really started 18 years ago, it changed her entire life. You guys hear that? Ladies? When the pain started 18 years ago, it changed her entire life. Okay? People with back pain like this, they actually don't do anything, you know? And she lives on a farm. She needs to go out and milk, and she needs to bale hay and do all the farm work, right? But she can't, because every time she does something, her back starts hurting. So what happens is they avoid things, activities, so their back doesn't hurt them. And then at some point, the herniations get bad enough 4 months ago that it's just constant pain. They can't live with it. Then they go find help, right? So the history is important. You want to know how long they've suffered with this pain, because it's robbed her of 18 years of her life. Yeah, the pop is a re-herniation. She re-herniated. So, yeah, that's good. But remember, the key question, the one that I bank on, is when was the first time you ever had back pain? Because that's really when it started. Shot? Any questions from our audience?
No current questions. We do have a couple of comments. This first comments come from Canes25 on YouTube.
Hey, Canes25, how are you?
And they said, you can be like Keynes and have to diagnose himself because the docs are around here are just robots. The docs around him are just robots and follow Epic's orders instead of their brains. There's nobody in the spine world as thorough as you, hands down.
Thank you. I appreciate the comment. I agree with you. And, you know, part of the reason why we're so thorough is because we know that the devil is in the details. So being thorough will reward us with allowing us to get our patient out of pain, right? These other doctors aren't thorough because they honestly don't believe you can get rid of pain. They believe back pain is chronic, non-specific. It has no identifiable source. So they've given up before they even started. And that's really important to understand. Okay? And yes, it's their fault, and no, it's not their fault. It's the system. The system is broken. The training, the education, you know, to teach them that back pain has no cause and no solution. That's what the system is teaching people. All you can do is do things to make it feel better, like therapy or pills or yoga, and that's all great. You want to be active, but at the same time, there is a cure. They just haven't found the right doctor to give them the diagnosis and the cure. But that's what Deuk Spine does better than anyone. And I appreciate you saying that, and I'm not trying to defend doctors for not doing their job right, but I mean, if I was lied to, I would probably believe the same lies, and I did believe the same lies that they did for years. As a neurosurgeon, we're told you can't fix people's back pain. The problem was we could fix people's back pain at Shands, at Gainesville, where I trained. My spine faculty were cutting edge, and they were doing fusions, artificial discs, before the rest of the United States was. And we were curing back pain. So I knew that that generalization wasn't true, that there was more to it. And I just didn't believe it anymore when I started curing my own patients' back pain. I realized that there's a lot of misinformation out there. And the only way to really decide what to do for patients was to make the right diagnosis as to the source of the pain. So thank you for appreciating what we do here, and understand that a lot of doctors are just culturally led to believe that pain cannot be fixed. So they act based on that belief, on that premise. So is it their fault? Ultimately, yes. They shouldn't be treating a condition they don't fully understand. Okay? But then that would make literally 1 million doctors that don't understand it. There's 1 million doctors in the United States, and that there's about 999,000 999. Yeah, thank you. That don't understand the causes of back pain, but we do. And that makes all the difference in the world. When you know where pain's coming from, you know how to fix it. Hold on. All right, so it's a little blurry. I'm trying to fix that. I think that's pretty good right there. Any other questions or comments?
No current questions, but we do have another comment.
You guys see the tear right there? Sorry, go ahead. I apologize. There's a tear right there. That's the one that's going up, I believe. See it? So there's one going up right there. It's the one we saw on the discogram. Go ahead. I apologize. Go ahead.
Next comment comes from Kelly on YouTube.
Hi, Kelly on YouTube. How are you today?
They said, women tolerate so much pain. We minimize it. So used to putting up with it. Her tears are freaking huge. Dr. Deuk will fix her right up. No heavy farm work for her for months. She needs to heal. Farm work is hard labor.
You are correct, Kelly. Thank you. Yeah, so you're right. And it is women that suffer. It's honestly men that suffer too. And it's kids, children that suffer. Even children get herniated discs. I've seen it, and I've treated it. So we as a society are so far behind in understanding the reality of back and neck pain. We need to bring ourselves into the, 21st century? And that's not going to happen until basically the whole system changes. And what really scares me is that I'm like one person who figured it out, but I'm trying to spread the information. And there's so much opposition to knowledge, to truth. It's so amazing. I never realized so many people would be against the truth. But there's a lot of people who don't want to accept the new truth, you know? And they don't want to. This is, by the way, a recent herniation. See that blue stuff? That's softer, less scarred up. It's also deeper, so it doesn't get as much inflammatory reaction on it. But it's blue, it's definitely abnormal, and it's degenerated. So it needs to come out as much as we can clean it out. Remember, normal disc is white. So basically what I'm saying to you is until the world accepts the truth for what it is, which is what we're trying to teach the world here at Deuk Spine, people are going to continue to suffer needlessly. There's the tear. They will suffer needlessly. All right, so this is really cool. See that inflammatory stuff there? The pink? You guys see it?
Yes, we do.
Along the tear. That is it. That's where all the pain comes from. I wish I could get a clearer picture, but I don't know why the focus, maybe that's better. Anyway, you guys see all that inflammatory tissue on the tear. Right where the tear is, it's on the annulus, and it's caused by that blue stuff, the nucleus. Okay, so we're here to zap it away. That is the cause of her back pain. We discovered that at Deuk Spine Institute. We're the first in the world to identify that and to treat it properly. So this is 90% of chronic back pain, folks, right here. That pink stuff, the inflammatory tissue. You're only going to get the right treatment today at Deuk Spine. All these other doctors are going to ignore you, tell you, just live with it, take pills, ruin your life, avoid, strenuous activity, avoid fun stuff, avoid hobbies, avoid all that. This is all scar tissue here. The white stuff here and the gold. The gold is calcium inside the scar tissue. Folks, don't listen to those doctors. They're wrong. It's funny. Sometimes I get people making comments like, how come you're the only one doing this? I ask myself the same damn question. How come? Why aren't more doctors doing this? Well, there's a lot of reasons. Number one, they probably don't know about it. Number two, they don't have the money to buy all the equipment because it's millions, $10 million, $20 million to set up a facility like this. Just one little facility. All the equipment, all the staff, all the building, everything is easy, 20 million. So you can't just do that as a doctor. Doctors don't have that kind of money. Now, if you're a rapper, you could do it. You just take a few gold chains off your neck and, you know, set up a spine center to treat people. But, you know, when was the last time you saw a rapper that you guys make super rich? Now, I see them in their private planes with stacks of $100 bills, you know, and tattoos all over their faces. Those are the people you guys are giving your money to. You should be giving it to doctors instead so we can make you better. I never heard of a rap song curing back pain, have you? Right? Or Floyd Mayweather. When was the last time he did anything to help people? Oh, look at that pinkness. That's beautiful right there. That's all inflammatory tissue. That's not blood, by the way. It's not bleeding. That's blood inside capillaries. Inflammatory tissue is pink for a reason. Look it up. Don't take my word for it. Inflammation. The 4 R's. Rubor, or no, it's not 4 R's, is it? Rubor, dolor, tumor, and dolor. Rubor, dolor, tumor, calor, which is temperature. Those are the 4 cardinal signs of inflammation. Redness, swelling, pain, and higher temperatures. The reason why it's warmer temperature is because you got all that blood going there. And remember, blood is warm. At least most people are warm-blooded. I think there's a few out there that are not so warm-blooded. Anyway, this is all scar tissue. You guys see all this right here? This is from chronic inflammation. It's like a thick block of cheese. None of this should be here. And some of it gets so big it pushes on your nerves, pinches the nerves, causes weakness in your legs, arms, whatever. If it's happening in your neck, your spinal cord. So I got to zap down some of this scar tissue because it's pushing on her nerves. And she's got horrible pain in her leg. And that's from this stuff mashing down on those nerves going down her leg. So I'm trying to, we call this a debulking. Remember, bulk is when something big, it's bulky, right? A lot of mass. We're trying to debulk, meaning, you know, get the mass out of it. Look at all this scar tissue. It's amazing. Is that her? Is that her talking or somebody else? All right, to give you a perspective, that glass fiber right there in front of you, that is a fiber. It transmits electromagnetic radiation. And the frequency of that electromagnetic radiation is in the laser frequency. Okay, the frequency of laser energy. Remember, what are some examples of electromagnetic radiation? Visible light, right? What we see, like when you look at things, flowers, horses, cars, houses, everything in your visual field that your eye detects, that's in the visual spectrum. Then, of course, you've got microwaves, right, which we cook our food with. That's also electromagnetic radiation. You've got infrared. We all know about infrared nowadays with all these cameras at our houses, watching people come and steal our Amazon packages off our porch. Okay. We've got laser. What is laser? High energy. You got radio waves, right? The old radio stations, they used to broadcast electromagnetic radiation and radio waves. So there's more, you know, there's more. I'm just naming a few. Light energy travels as photons, right? We call those photons. But basically what I'm getting at is the energy that's delivered to the end of this glass fiber, it's delivered by the glass fiber. It literally comes from a machine over here behind me. It's a big machine, it's about the size of a big suitcase, and it's on wheels, and it plugs into the wall, and it sucks up electricity and generates energy that transmits along this glass fiber. And then I direct the glass fiber energy right to the tissue that needs to be ablated, vaporized, and the laser energy gets absorbed by the proteins in that tissue, and it causes those protein bonds to break. Now this entire thing is FDA approved. All right, this laser is completely FDA approved. So, a lot of scar tissue here. Questions?
This next question comes from Kelly, once more on YouTube. And they ask, will you be opening a facility in California by chance? If not, I will be headed to Florida soon.
Yeah, Kelly, you're right. You know, we will be opening a facility in California in the future. I don't know when. I wish I could tell you it would be soon. But I do have a California license, and that's obviously not a big deal. But, you know, it's the money, and it's the time, and I'm only one man. I've got a great team of people, but the reality is that you're talking about expanding a business that's very, you know, very important. It's very important to me that if we do expand, the most important thing to me, the number one, is that we don't lose quality. We don't do worse. We always have this high standard, and we maintain it. And that comes down to people, the people that work for me, you know? And the more facilities I have, the more chance the people working for me become substandard, subpar. They're not good enough to do what we do. I mean, I know it looks like I'm just, hey, it's me, right? But it's not me. It's an entire team of people, 70 people right now. And I can't do this without those people doing their jobs properly. And every time somebody doesn't do their job right, it puts the whole operation at risk, and it puts the patient's health at risk. So for me, if I'm going to do it in California, it's got to be done right, just like it would be anywhere else. There's nothing unique about California. It's got to be done right anywhere. So I got to have people I can rely on. Okay, if I have good people I can rely on to do everything right, then we can open a place in California. Honestly, the money's not an issue. I've got companies that want to invest. They want to put the money in and build these places. But I don't want to do that because I don't want to compromise quality. I don't want there to be people dying, bad outcomes, bad accidents, you know, sloppy care. That's not how I want my name and reputation to be remembered. It's important that we do it right. So, as I start training and growing, we will eventually be in California, but we're not going to open anywhere unless I'm sure the quality will be good and it can be maintained good. In the end, we're taking care of a human being, and they have a life to live, and we want to be a solution, not a problem for them. We want them to be better, not worse from our treatments. And it's very easy to make people worse, by the way. Very easy. Just one mistake, which is why I get on my staff so hard. Because when I start to see a deviation from norm, it tells me somebody's sleeping at the wheel. And that's what it takes, is to being distracted, just for a moment. And that's when catastrophe happens, right? Especially in medicine and surgery. Of all things, you know, in surgery is where you can really hurt the patient the most, the quickest. There's other ways too, with medication errors and, you know, well, poor anesthesia, for example. There's a lot of ways to hurt patients. And so we want to not hurt anybody, so we got to stay on our toes. So I demand a lot from my people, and they demand a lot from me. All right, that looks good. All right, wait, there's something there. No, lights off. There's a little bit of scar tissue just under the nerve there, and I want to make sure I don't leave anything there that could cause symptoms. That looks good. All right, good work everyone. That's one down, a few more to go. Great questions. Keep them coming. I'd say California in probably 5 years, if I had to make my best guess. Orlando is going to be our next center. Orlando, Florida. That will probably be our main center for years to come. It's a nice place to visit. It's easy to get to. The airport there has so many flights in and out. I will tell you this though. I was shocked the other day. I went there to pick my daughter up. She's coming back from DC. And my God, have you guys seen the traffic at the airport these days? It's like, what's going on here? I've never seen so much traffic in Orlando. It's really weird. To be honest, they just opened the sea terminal. I don't even know, maybe they're just doing more flights. But the traffic was backed up for miles. I've never seen that, except on like holiday. It wasn't holiday, I don't think, it's just summer. Lay still, you're doing great. So we're done with one disc. We're going to move on to another disc. 3-4, yeah. Yeah. So we're just getting our X-ray machine in position. Which machine is that anyway? It's got nice pictures still. It's real good. Those older ones work great. So I should say that, like for example, one of the problems is that we bought 2 brand new top of the line X-ray machines and they're both not working. $300,000. It's a shame. So listen, all you people out there worried about AI, machines don't do their job either. They'll probably break down. If you're worried about the Terminator scenario, machines, shoot. Even the top of the line, best machines in the world, they all break down. So should give John Connor some hope. Tell me you've all seen the Terminator. My God, it's on Netflix, right? I saw it years ago, back when it came out. Shot? We did some num-num, doctor. Anyway, I called Edwards. He didn't answer. Left a message. Hasn't called, texted me back. So. Huh? In France? What the hell is he doing in France? Ah, vacation. Is he hanging out with his buddy, Yannick?
Yeah. I saw him on Facebook.
Is that right? Yeah, my friend works for him.
Oh, really?
Has a distributorship. Said he's doing really well.
He's in racing, right? Or,
Huh? Race, he builds motorcycles. Why something? I don't remember the name. All right, any questions for us?
Yes, we have a question from Vic on YouTube.
All right, Vic, on
They-
YouTube.
They ask, "Hi, how long is the recovery for this procedure?"
The recovery is 1 hour, Vic. Literally 1 hour. You can actually go back to work the next day if you really want to. Light duty, of course. You can't go back to heavy construction or football or anything like that, but you can go back to work the next day. A lot of people do. It's a tiny incision. We're not causing any damage inside the body, at least not intentionally. Basically, all you're doing is spreading open the muscles and to get from the skin to the disc, we're like not hurting anything. The skin itself is cut, but that heals pretty quick, and usually the pain from the incision's gone by the next day. So what hurts people with normal spine surgery is is the muscles and the soft tissues inside. The surgeons destroy it. You just don't see it because it's hidden. And they don't show you their surgery videos. We do. You can go watch some of my fusions. If you go to our YouTube channel, you can go and see a Deuk spinal fusion, and you'll see why people have so much pain after those surgeries. Because with fusions, you're actually literally mangling the inside of their body. It's just all hidden by their skin incision. So that's why it hurts so long. Some people have pain for years after their fusions because the surgeon destroys so much of their body inside, and they don't know about it. Surgeons don't come out and tell you, oh yeah, I destroyed your body inside, by the way. Surgery went well. Look at your sexy little incision. By the way, I destroyed your body inside. That's why you're going to hurt. The reason people need narcotic painkillers after surgery, spine surgery, is because of the damage the surgeon does. It has nothing to do with the actual problem that you go to the doctor with. You notice how after open spine surgery, you're in so much pain, you want to you're on a morphine pump, right? Writhing in bed in the hospital. All that pain after those surgeries, it's not from the actual screws or rods, it's from the damage to your muscles and your body that the surgeon creates. Why? How do I know? Because I figured it out and I started doing fusions without damaging the muscles and the body. And guess what? My patients went home 2 hours after their fusions. Go look it up. Dancing fusions. We've been doing outpatient fusions for 10 years. Even highly invasive surgeries. The reason why we can do that and my patients walk out of here and dance out of here the same day, 3 hours after their surgery, because I don't damage their body. You see, once I realized that I was creating the pain by damaging their soft tissues, I stopped damaging their soft tissue. Look at that tear, by the way. Okay? This white stuff is pretty much normal nucleus. But right next to it is the blue stuff, which is degenerated nucleus, part of the herniation. But the white stuff right there is pretty much normal nucleus. You guys want to know what normal nucleus looks like? That's it. You see how it doesn't stain blue? Only the degenerated stuff does. So I'm leaving the normal stuff alone. I'm only taking out the degenerated disc, okay? Degenerated nucleus within the tear. This is all the annular tear right here. Chock full of this herniated nucleus. We're literally on the border of the nucleus and the annular tear, and you can see how the nucleus starts right here, but there was a tear below the nucleus right between it and the bone, and all this blue stuff is destroyed, damaged from inflammation, nucleus pulposus. Now, had this patient who's had pain for 18 years, had they come to me right away, this wouldn't be like this. This is the tear. I'm cleaning it with a laser. If this patient came, and if you all come immediately after you get back pain, that's chronic, it lasts 6 weeks, let's just say, and get this surgery, then you won't have any of this degenerated disc. You'll be able to preserve your normal disc because we're getting rid of your inflammation with the laser surgery that we do. By the way, might as well say it. If you're a doctor out there, a surgeon, spine surgeon, and you're interested in what we do at Deuk Spine, this is the future of spine surgery today. If you're interested in learning, we would invite you, but there are criteria, okay, and you can apply. I've had doctors email me wanting for me to hire them, and I'm not going to hire any doctor, okay? You have to be good, really good. So if you're not really good, don't even bother. What makes you really good? Well, there's a couple of types of doctors I'm interested in. One, I'm interested in the mavericks, surgical mavericks. What that means is you are literally, think of Top Gun, you know that group of pilots, the best of the best, that's got to be you. Now, I don't mind if you're doing clunky old surgery. I'll teach you the right way to do surgery, but your technique has to be good. You have to be intelligent. You have to be top of your class, and I'll train you, okay? So that's the surgeons. And then the second group of doctors I'm interested in at Deuk Spine are research. We need to publish our results. We've got so much data and so much new technologies, they need to be published. So I need doctors that publish papers, write papers and publish papers. I just don't have the time to do it like I used to, but the word needs to get out, the data needs to get out. So I'm looking for those two types of physicians: writers, paper writers and publishers, and surgeons. In case you're out there wondering, could I come to Deuk Spine and get a job? We are getting busy. We're hiring more doctors to keep up with the demand for our services that people deserve and should be getting. I can't do it all myself. Right, Luis?
Yes, sir.
You're supposed to say no, Dr. Deuk. You can do it all. Questions? Almost done with this one.
Next question comes from Paul on Facebook.
Paul, thank you.
They asked, is this treatment a permanent solution to the nerve pain like DVR?
Yes. Yes. So, Paul, great question. Is this treatment a permanent solution to the nerve pain like DPR? The answer is it is a permanent solution, but it's not the same kind of pain as a DPR. See, a DPR treats. It's hard to explain, but I don't know how much background you got. But there's two types of joints in the body. There's what are called diarthrodial joints, which have a synovial membrane. They have synovial or cartilaginous surface, and they have, between two bones that come close to each other. Your knee, your hip, your facet joints, your shoulder. Those are all examples of diarthrodial joints. They have certain characteristics. Then you got the disc, which is not a diarthrodial joint. This is the disc that we're fixing. So diarthrodial joints, that's where you use the DPR, Deuk plasma rhizotomy. Shoulder, hip, knee, facets. And you want to denervate the joint by killing the pain nerve to the joint. But with the disc, there is no pain nerve to the disc that we're killing. We're actually cleaning out the inflammation and the source of the inflammation, which is a tear. This tear right here that I'm literally cleaning right now, getting rid of the herniation stuck in there. So this is not a nerve that I'm buzzing with the laser. This is a debridement where we're cleaning out the tear, getting rid of scar tissue, herniated disc, inflammatory tissue, calcium, bone spurs, and the herniation. I already said that. Yeah, it's a different procedure. Different procedure. Now we could do a rhizotomy with the laser, but we tried that. It's a pain in the butt. I mean, it's really not worth it at all. And the best is the Deuk plasma rhizotomy. Remember those days, Luis?
Yeah.
Compare Deuk laser rhizotomy versus Deuk plasma. Plasma is much better for rhizotomy. Man, those laser rhizotomies. We tried endoscopic laser rhizotomies for a while, and it was so long and so hard to do. The scope kept moving, shifting position. It was a pain in the butt. And in the end, it was, didn't really work that well. But my God, the DPR, bam, whew, 100%, 100%, 100%. It's like your perfect spelling bee student, never missing a single word. Right, Berndes? Yeah. We have never had a failure with the DPR on the diarthrodial joints that we've treated. All right, this is the end of the disc and the end of the herniation at L3-4. This was a really painful, remember? Actually, this was an 8 out of 10, but she almost came off the table when we injected it. So it was very painful for her. And then we got one more to do. The last one is at the bottom there, L3-S1.
Yes, sir.
Great questions from our audience so far. Any other questions? You know, surgery is not that hard, folks. You do what works. I think that's the key. You do what works. And, you know, you do your treatment, you assess it, like how did the patient do? Did they do well? Did they not do well? Why didn't they do well? Was it because of the treatment? Was it a side effect or complication? Was it the wrong treatment? The treatment's just not that effective because you're targeting the wrong thing or doing the wrong thing. And that's just how you get better and better and better as a doctor, is always assessing what you're doing and asking yourself, how do I make this better? What could I do better? That's what it comes down to. By the way, I will say one more thing. We are getting ready to start performing the piriformis releases. Probably in a few months, we'll be doing our first one. And a piriformis release, for those of you who don't know, basically there's a muscle in the buttock called the piriformis muscle, and it is so commonly it just gets torn and inflamed and hurts people. And so we've always been doing shots for it, and then we now are actually getting ready to start doing a more permanent treatment, okay? Because we're seeing so much of it that people need a permanent fix. All right, great questions. Any more?
No current question.
Great. So we've done a nice debulking. You can see the fibers there of the foraminal ligament, posterior ligament. And we've taken all the herniation out, just about. This is the last few milliliters of herniation. I'm happy with that. The nerve is going to be there in the fat. Just going to blast these last little pieces. All right. Great job. Scope off. Nice job, ladies. One more to go. Great questions. Let's any more questions, Henry? In case you don't know, that's antiseptic. You can't hold the tube where I'm holding it, all right? Oscar?
Sir?
Can you explain that to him?
Don't hold it. Oh, yeah, you don't say like that. You gotta lose. Yes, sir.
You know, your hand and my hand are now competing for the same place. You want to hand a surgeon an instrument so they can grab it the right way and not have to grab it and reposition. All right. One more to go. I tried.
Actually, I thought it was gonna be easier because the pseudo disc.
Huh?
I thought it's gonna be
Pseudodisc.
more. You know what I'm saying?
Yeah, but she's got some just abnormal anatomy there. You know. Any questions?
No current questions, but we do have a comment from Kelly once more on YouTube.
All right. Well, let's take the comment and then let's go to the how does the Deuk laser disc repair actually work?
Copy that. Their comment is, well, I know I have performing issues. They are tight, a lot of pain, especially with my back. IMG piriformis not performing.
Uh-huh. She's saying she has piriformis?
I believe so.
Got it. Could be. I could diagnose you if you ever want to do a free MRI review. We can do that for you. Last one. Num num. Here, a little more pressure. A little more pressure here. Yeah, so Deuk Spine Institute is able to do virtual consultation on the internet with you for free. Not just you, we offer this to anyone. The only people I don't offer a free consultation to are people with extremely complicated spine issues after multiple surgeries where they've tried all kinds of treatments and hasn't worked, and well, let's just say they save us for last. Right? And I don't mind being helpful, but those patients generally have very complicated issues that take a lot of time and thought and effort. They go way beyond the scope of a free MRI review. Come on, Jordan. So, for those patients, shot. We do charge a small fee, but most people get a free MRI review. So feel free to come see me in my virtual office. Shot? Like many people do. Shot? All right, remember, we are inside this disc, but we did not stain it blue because we couldn't get in. Huh? Nope. I don't need to stain it blue. I'll be able to do what I need to do without staining it blue. I'll do what I need to do without staining it blue. You like that, Dr. Berndes? Huh? Like Deuk Spine nursery rhymes, right? Any more questions from our live stream viewers?
I believe what we do have, I think this person is seeking for advice. This comes from Paul on YouTube.
Hi, Paul.
They said, I've had 3 epidural injections in my lower back, and I had an extra one done in the facet, and now they want to do an ablation that will probably only last 6 to 12 months. I'm looking for a longer-term solution. My disc is bulging a lot into my spinal cord.
Yes, Paul. We have your solution. If it is your facet, it's the Deuk plasma rhizotomy. If it's your disc, it's the Deuk laser disc repair. But we're able to do either one or both. Some patients need both done. Some just need one done. This patient just has disc pain, at least at this time. Now, could she end up with having facet pain as well? Sure. You know, we, just so people understand, when you come to us with a problem, with pain, the first thing I'm going to do is I'm going to have you point on your back where that pain is coming from. And what I can tell you is that if you're pointing to 2 or 3 spots, I'll figure out exactly what you're pointing to. I will fix those spots. It's very easy. It's either laser or plasma. On the other hand, if you're pointing to 3 spots, but you have a 4th spot you're not pointing to, and you didn't tell me about it, or you didn't have it at the time, and you get it later because you're more active and it aggravates, we can still fix that, but it may require you to come back and get that done. So, you know, the thing about pain in your back is that it doesn't always hurt the same all the time, right? So if you come to me and, you know, 3 out of 5 pain sources are hurting, but 2 of them are not, I don't know about those other 2 pain sources. There's no imaging study that tells you, hey, all 5 are causing pain. The only way to know is to see it on exam. And if I don't see it on exam, I can't fix it. So it's very important people understand that. It's not that I can't fix all the pain, we can. It's that I gotta know the pain, where the pain's coming from to fix it. And I can't know where pain comes from if you don't tell me where pain comes from. So pain is something the patient experiences. It's only diagnosable on a physical exam. It is not diagnosable on anything else in the world. You may say, oh, but you can look at my MRI and see a fracture. Well, guess what? There are lots of people with old fractures that don't hurt. We don't treat them. If you have an old fracture in your spine and you got a herniated disc and the fracture's old and it already healed, you'll still see the fracture. It'll be there. But you won't have pain coming from it, and there's no reason to treat it. Less than 5 minutes. Less than 5 minutes. Yep. This is our last disc that we're fixing. Again, we didn't get to put the blue dye, but there's several herniations here. I'm glad we're doing it. I knew this thing was going to be part of her pain. Any more questions from our audience?
No current questions. We do have a comment from Kelly once more on YouTube saying that she's sending the MRI and CTs tomorrow, and from quote on Kelly, I already have horrible neck and L5 to S1 fusion.
Okay, just give me that last sentence. Something about neck and
I already have horrible neck and L5 to S1 fusion.
all right. Well, I see. So she has a fusion in her neck and her lower back.
Correct.
Oh yeah. All right. So basically, Kelly. By the way, if you've been watching, notice the herniations are white here. Okay. These are, and this is important. These are herniations that are white. Why are they not blue? They're not blue because we didn't put the blue dye, the Deuk spine dye, right? So that's my whole point. When you do put the blue dye, you can see the bad part of the disc as blue and the good part is white. But when you don't put the dye, the whole disc is white. The herniations. The degenerated disc and the normal disc all look basically the same. Which is not as big a problem for me because I know what normal disc looks like and I know what degenerated disc looks like. They're both white, but the degenerated disc has a certain appearance to it and a certain location to it. But anyway, Kelly, yes, we can definitely help you. Look at that herniation. 2 minutes. So our next patient, this patient is from near the villages in Florida. So she's what we call local. She's Floridian. The next patient is from Rwanda, Africa. You heard me right. Just like you, he found us online and was very impressed with our treatments. And of course, there's nothing like that offered in Africa. So he's here.
I'm told by Sheena he's going to be last, so I think the third patient will be broadcast.
Oh, I apologize. That's fine. All right, so I stand corrected. Laser. So the next patient will be a broadcasted patient, and it will be a single level, right? I think he's a single or something. I don't know. Is he single? Well, we don't know where he's from. I apologize. The last patient is the one from Rwanda. Okay? And he does not want broadcasting, so we will not be, hold on, he will not be broadcasting. So, you guys don't expect to see that. We always respect our patients' wishes. It's the proper thing to do. After all, it's their body, their surgery, and they should control whether we broadcast or not. In the future, I could tell you, Deuk Spine is going to have a live reality TV show, reality TV, and that's in the future. And we'll basically have to have all of our patients signing a waiver that they approve being on video, being on TV. Because that's exactly what we're going to do. We want the world to see what we do. We have nothing to hide. We want people to see the results. We want people to see the good and the bad, the whole kit and caboodle, under the kimono, lock, stock, and barrel. Right, Luis? The entire enchilada. Why? Because, well, why not? I mean, there's a lot of shit on TV that is garbage. You might as well watch something that's useful. One minute. This is it, the last of the disc. This is the last of the tear, right here. It's beautiful. Beautiful, beautiful, beautiful. This lady is going to do so good. I can already tell. 3 discs, all nailed perfectly. I'm very happy. She's going to be happy. I wonder if our first patient's already gone. Anybody know?
I already was doing very well.
Yeah, he had no pain. Huh?
No pain.
So he wants to see him see me. I'm sure. All right. Yeah. Our first surgery that you guys watched today, he was doing so well. He had no pain, no painkillers, no pain. He was just so happy. He's from Oklahoma. Yeah. Thank you. Well, Berndes, all I can tell you is we need to get another anesthesiologist, and the more you can help me, the better. Okay?
I just don't know anyone in Florida.
Let's move them.
I've been involved for 22 years. I don't know
Oh, cut that shit out. They don't have to be in Florida. They can be somewhere else, as long as they're good. Any questions for me?
Yes, we do. This next one comes from Vic on once more on YouTube.
All right, Vic.
And this is not a question. They just comment, but they did say, I have already filled the info through the website. Today, I will be mailing the MRI CD with the report. I have a central disc herniation in my L4-5 disc.
Wonderful, Vic. We will help you. At least you'll get answers and what needs to be done from our time together. Look forward to meeting you. All right, great job, everybody. Wonderful. Thank you so much. As always, we got everything that we needed to get done. 18 years of back pain is ending now. Oh, yeah, no worries. It's okay. It's all about learning the right way to do it. Yep. All right. Let me just show you guys real quick the incision. Okay. Can you see this here? She had 2. And the reason we had to do 2 is because those 3 discs, normally I can point from one incision. So I can just redirect and go in. But because of the way her spine is, she doesn't have a great curve. So I had to actually go up here and go in, and then I got the other 2 down here. So it is what it is, but we got everything done, and she has 1 little extra Band-Aid incision. 7 millimeters, no downtime. This is outpatient surgery. She's going to go home in about an hour, hour and a half. Thanks to our great team and our anesthesiologist. Dr. B for bad. Badass. Badass. You guys making shakes? All right, let's go ahead and take questions. I'll come answer them for you guys, all right? EBL 3 mils. Henry, go ahead. Good morning, I'm Dr. Deuk at the Deuk Spine Institute here in Melbourne, Florida, with one of my patients who traveled from California. He's been suffering with his lower back pain for years and found us on the internet and decided to come here and have the endoscopic Deuk laser disc repair. We performed that 12 hours ago. and here you are, ready to go back to California, it looks like. How do you
Yeah.
feel?
I feel great. It took a long time to get to you. Surgery was quick and painless. I don't remember a thing. Your staff was wonderful, but I am pain-free.
That's awesome. Yeah, and you're going to stay pain-free. We don't have you on any pain meds. We don't have you on narcotics killing your pain. We didn't put any medicine in your back to stop your pain, so what you have is natural. And do you feel that pain anymore that you had before you came here?
No, the pain is completely gone. In fact, I quit taking my own pain pills 2 or 3 days before I got here, and I am on no pain pills at all, and I feel wonderful. When I woke up this morning, it was a different day, and I feel great.
And I feel wonderful for you for doing that. That's why we do what we do. We can cure pain, and we want everyone to know that, because nobody should have to live with pain every day. How does pain affect your life every day?
Pain is traumatic. The kind of back pain that I was suffering put me in bed. And for the last 3 months, I have been absolutely useless. Absolutely useless. And so I found you. It took me a few months to get here, and it was worth the trip.
It will be for the rest of your life worth
absolutely.
the trip. Pain robs us of our dignity, doesn't
It does. It absolutely does.
And your parents are here, and they're very supportive, and that to me is so important, that you have people that understand what you're going through. I'm sure your parents have been a big support for you.
Oh, absolutely. Yeah, I was at work, a short story. I was at work last Wednesday dealing with this pain, and my back finally gave out to where I literally could not walk anymore. And I was 600 miles from home, and so I called my mother and father. They flew to San Diego and arranged the trip to get here. I called your place. I was scheduled for February 2nd, and I asked Richard on the phone if he could get me in sooner, because I was desperate. And you guys got me in a week or two sooner, got me in the 24th, which was yesterday. And so we made the arrangements, and I flew here, stayed in the hotel for a couple days, and was operated on yesterday. And yeah, it's well worth the trip. I apologize for getting emotional, but it's been a long trip to get here.
Well, we want you to get emotional, because it is an emotional thing. When you've been burdened with this pain for so long, and then suddenly it's gone, and you realize that life can be lived without that pain, you know, and that you can actually have a life without the pain.
Yeah.
So what are you going to do now that you don't have the back pain anymore?
Well, I'm going to get my life back together. I've got a new job, and they've saved it for me. My boss is wonderful, and I'm going to go back to work tomorrow, actually, if you can believe that.
Yeah.
And I'm going to start riding my bicycle again and getting healthy again.
Well, your surgery went very well. I don't know if you've watched it yet, but we were able to get in with a tiny 7mm 1/4" incision and fix both painful discs, and they were both very painful for you. And the pain was coming from a small tear that's located in the back of your disc where your herniation came out of. And that tear was just so inflamed, and we were able to clean out the herniation that was stuck in your tear and use the laser to debride it. And that's what the Deuk laser disc repair is. It's a debridement of the annular tear to eliminate back pain and leg symptoms. So we also have a cyst. We didn't treat your cyst. And do you think the cyst is causing any problems for you?
At this point, no. I don't think so, because all of my symptoms are gone. This morning when I woke up, I was a little nervous about getting out of bed. But that subsided quickly when I stood up and could stand up completely erect with no pain or bindage feeling in my back.
Yes, when I walked in and saw him this morning for the first time, the first thing your mother said was, "Look how straight he's standing." So they must have watched you suffer for a long time.
Oh yeah. Yeah, my mom's a great lady. I'm blessed to have her in my life. And then that's my stepfather, Jerry. He's a wonderful man. He and I are pilots. We fly together. We do a lot of things. And he's seen me go downhill. He knew something was wrong, you know.
How did you find out about us?
I've been seeing a chiropractor in Sacramento for 35 years. And 2 months ago, I started to really feel bad. And I would go to him. And after about a month of going to him, and going to my doctor for some pain management for these symptoms, I finally figured out that something else was wrong with me. And so I asked the chiropractor, what can we do, because what you're doing is not helping me. My doctor put me on pain meds, and they took some of the sharp pain away, but nothing was helping. And so being kind of a mechanical engineer, I decided to look into how my back was put together. And I requested an MRI from my doctor and from my chiropractor. And so that took 3 weeks to schedule. That's a long story. And I finally got an MRI, and I looked at it myself and realized that I had a cyst of some sort and that I had some problems with my lower discs. And that's when my chiropractor told me about you. He said, get on the internet and do some research and then call these people. So I called your store. They gave me some information. I FedExed my package to you guys, and a week later you called me. And about a week or two later, I got here.
Wonderful.
So, yeah.
And here you are pain-free for the first time in many years.
Many years, many years.
Congratulations.
Yeah. Thank you.
Is there anything you want to say to your fans out there?
There is. This is a miracle. In Sacramento, everybody that I know said, why are you going? Why are you going to Florida? Why don't you find somebody in Sacramento? And I said, well, because I was referred to Dr. Deuk and I've done a bunch of research on him, and I just have a great feeling about him. Not only that, he personally called me on the telephone because I told his people that I had some questions. And that's what sealed the deal. And so it took a while to get here, but it was worth everything. And I would recommend anybody send your MRI to this guy, and if he can help you, he will. Okay? Thank you, Doc.
You're welcome, sir. It's my pleasure.
Yeah, absolutely.
All right, go enjoy the rest of your
All
life.
right, thank you.
Okay, great. Thanks for that. It was a wonderful testimonial. As always, Henry does a great job of mixing. You know, in the old days, DJs used to mix the tables. You know, we would stream music over the radio station. I was a DJ in college, and I had my own show for the University of California, San Diego, and I would mix records. And now we have Henry here mixing movies. So it's a little different than mixing sound, but he's mixing sound and video. Surgery went well. We didn't have any problems. The only thing I couldn't do was get that needle into the L3-S1 disc in order to do the discogram. And I'll show you why. I really need a new model at some point, but this one, here's one. This one has the fusion metal, and this one doesn't. So I'll show you this one. So here's kind of what happened. I came in, my approach was again from the back to the side, oblique, transforaminal. I bumped up against the facet, and I was redirected kind of down, and then I hit this bone right here, the lip, and I could not get the needle to go in the disc. So I just planted it there. I tried for a while, twisting it, turning it, playing with it, redirecting it, you know, but I just kept hitting that bone and hitting the bone and hitting the bone, and I was trying to get my needle to wiggle and skive right into the disc so I could do a discogram at 5-1, but I couldn't. So we left it alone, and we just treated it. When she was asleep, I was able to get the dilator in. We did test the discs at 3-4 and 4-5. You saw she was like, oh, right? And when I do a discogram, I'm injecting a little bit of dye into that painful disc. Well, if I inject a normal disc, there will be no pain. If I inject a disc that's not painful, but it's damaged, there will be no pain. So I already know where the discs are that are causing pain because, number one, I have the patient map out on their back for me, like, where is your pain? And then I look at the MRI and I can see what discs are there that are damaged. And usually what happens is the pain's right here. Like, you know, when you're pitching in baseball, you want to get that ball to go right into this zone. What is it called? That square? Strike zone. You want the ball to go in the strike zone. So for every patient, they've got their strike zone, which is where their back pain is. And if you have a herniated disc up here, degenerated disc up here, it's above the strike zone where their pain is, then that is not causing pain. Now, if I were to do a discogram on that disc, it would not cause pain because it's not a painful disc. That's why we ask the patient, after we create the pain, Is that your typical pain? Because if they say, no, I don't normally have pain there, then that's not a disc causing their typical pain. But in her case, the 2 out of 2 we tested, 2 out of 3 that we need to treat, they caused her typical pain. We call that concordant. It's a funny word, I didn't make it up. I was taught it, but concordant means your typical daily pain. All right, what questions do we have?
First off, we have a comment that comes from Kelly once more on YouTube. And just from the comment that said that they have horrible neck and L3-S1 fusion, she wanted to reiterate that she has cervical stenosis in neck, no fusion, and in the neck it's 2, 3, 3, 4, 4, 5 sitting on each other with 6 to 7 pinched nerves.
Mm-hmm. Don't worry, Kelly. I will be able to, in 30 seconds, tell you exactly where your pain's coming from. But I will need you to help me. I cannot do it on my own. I'm going to ask you a few things. I'm going to ask you to do a couple of things. Number one, I'm going to ask you to take your finger and put it on the spot where you have the worst pain. Okay? Number two, I'm going to ask you to turn your head side to side and see if that makes the pain worse on the side you're turning to. If it does, I'm going to ask you to touch that spot where it makes it worse. Okay? That's your facets, by the way. So, between your disc and your facets, that's going to be 100% of your pain. I just got to figure out which discs and which facets. That's why the touching and the marking. So if you want to do that before you meet me, that would be helpful. If you turn your head to the right really far and you feel a pain here on the right, just put an X mark with your pen and then show me those X marks, okay? And that will make your visit go by much quicker. Yeah. Right, Sanjay?
Yes, doctor.
Computer vision. All right. Next question.
Next question, last but not least, comes from Kit on YouTube. And they asked, I had the laser repair by the other doctor, no more leg pain right away after the surgery, but my back pain is still the same as before the surgery. Does it sound like I have a facet joint pain? I'm very interested in the DPR.
And what was the name?
Kit.
Kit.
Yes.
Thank you for sharing. First of all, I would love to know who the other doctor is, but you don't have to share that. Here's why, Kit. Here's the problem. This has been going on for years. When a patient comes to a spine surgeon, the first thing the spine surgeon does is say, can I help you? Can I fix you? And to answer that question, the first thing they're going to ask is, do you have leg pain? And is it due to a pinched nerve? Do you have leg pain? Is it due to a pinched nerve? In other words, all spine surgeons do is fix leg pain through their microdiscectomies, laminectomies. They don't fix back pain. That's one of the biggest differences with the Deuk laser disc repair we just watched versus a microdiscectomy, laminectomy. Microdiscectomy and laminectomy are designed to get rid of leg pain. They never fix back pain. They actually make it worse because they're destabilizing the spine by removing bones and ligaments. The Deuk laser disc repair treats the annular tear. Your surgeon never treated your annular tear. How do I know? Because I'm the one who discovered the treatment, and I'm the only one who does it. Okay? So, the only way you can treat the annular tear is with a laser endoscopically. So if they're not doing a laser endoscopic debridement of your annular tear posteriorly, they are not going to get rid of your back pain. It's that simple. So the Deuk laser disc repair gets rid of the leg symptoms and the back pain because I'm decompressing the nerve root and I'm getting rid of the inflammation that causes the leg symptoms because it affects the nerve root right behind the disc. I also treat your back pain because I'm doing an annular debridement. We're the only ones that do the annular debridement. We're the only ones who consistently get rid of back pain. So we can still fix you. Just do an MRI review, mri.deukspine.com. I'll be able to tell you if it's your facets or your disc based on the location and whether you have tenderness over the facets.
And no current questions, just a comment from Kelly stating, yeah, my range of motion is bad on both sides.
Well, in that case, you may have facet pain, which is great news for you because it means you don't need surgery. You need the Deuk plasma rhizotomy, which is not technically, I guess it is surgery, it isn't, but it's a small little cut outpatient, done with a probe, where we go in and burn the pain nerves. I'll see you at your telemedicine, Kelly.
And that is it.
All right, thank you. Thanks, Henry.